I talk like this. Welcome to the Pearlii Podcast. We're back. Welcome to the Pearlii Podcast. Today we have, I always call them very special guests, but this one's true. Dr. Som-Ling, a dentist from the Sunshine Coast. Thank you so much for joining us.
Thank you for having me.
Well, this was a topic suggested by you. I know nothing about this topic, so I'm going to be the village idiot in this case and ask a bunch of silly questions. But we're talking about oral health during pregnancy and probably postnatal as well. So why is this such an important topic? Why is it different? Is oral health more important during pregnancy? Are there changes? What can you tell us about it?
It's certainly oral health is important during pregnancy. There's several aspects. You often hear people talk about when they're pregnant that they're just bound to get bad teeth. They're bound to lose a tooth or have problems with their teeth, and it's almost an accepted thing. But it's not actually the case. You are more susceptible to gum problems. So often people especially around the 7th and 8th month, they will notice their gums bleeding a little bit more.
Oh, right. Why is that?
So what happens during pregnancy is you've got a lot of hormones running through your body. So if you have a little bit of plaque around your teeth, often not during pregnancy, they don't react too much, but during pregnancy, they would react a lot more. So if you have really clean teeth, then the gums are not going to bleed. But if you have a little bit of buildup, they're probably going to bleed a lot more. So we often tell people to go and get their teeth cleaned during pregnancy so that you have really good clean teeth and less likely to get the gum problems and the bleeding.
Okay, is it a reduced immune system?
Yeah, your immune system's a little bit different. I suppose it's putting nutrients towards the baby, and just your whole body changes with the hormones.
What's the key piece of advice? So if we've got listeners at home that are pregnant or are planning a pregnancy, what advice would you have to them?
I would probably suggest going to see a dentist during your pregnancy to get your teeth clean so that there's less plaque around there, so you're less likely to get the gum problems. If you have severe gum problems, it can affect the birth, so you're more likely to get premature births, and it's also linked to low-weight babies. So it does have an impact on your overall health. The second thing is making sure that your teeth are in good condition and you don't have any dental decay. So once the baby is born, if you've got a lot of decay in your mouth, then you've got that bacteria in your mouth, and when you feed the baby and you taste test the food and then give the baby share the same spoon, then you have potential for transferring that bacteria to the baby at an earlier stage than what would normally happen.
So one myth I've heard, I don't know if it's a myth, is that during pregnancy you might be more likely to lose teeth. Is there any truth to that?
Yes and no. So basically, no, it's preventable. But what can cause decay during pregnancy is if you suffer from morning sickness, and if you're vomiting a lot, that acid coming up and can dissolve the teeth and then cause decay. So that is a common problem. The other aspect would be a lot of people during pregnancy get food cravings. So if you're constantly nibbling on chocolate, or if you're nibbling on apples or carrots, that's fine. But if you're nibbling on the chocolate and having constant sugar in your mouth, then you're going to be more prone to getting holes as well.
Okay, yeah, that does make sense. And I've said on another episode that I had reflux growing up. And the dentist said, "Oh, that is really bad. It's basically battery acid you're putting up inside your mouth there." Scared the hell out of me, but I don't have it anymore, thankfully. So that does make I can relate to that one with the vomiting. It's not good.
Yes, the vomiting regularly for a certain period of time can be quite detrimental to your teeth. One of the things that people often don't realise is that often when they do have that vomiting, it leaves a bad taste in your mouth, so then they go and brush their teeth straight away. The trouble is the acid actually dissolves your teeth a little bit, so you shouldn't brush your teeth straight away, because then you're brushing away that softened tooth structure.
Oh,
what
no.
is actually better, so what is actually better is just put some fluoride toothpaste on your teeth. If you are...
And don't brush, just put the actual...
Don't brush.
Oh, right. That's a great tip.
So because those toothbrush bristles are a little bit harsh, and then you've got softened tooth structure from the acid, and then if you brush your teeth, then you're going to brush away that softened tooth structure. You're much better off just to leave it. Put some fluoride toothpaste in your mouth. Alternatively, a glass of water with a little bit of bicarb soda. That's something alkaline, so that can neutralize the acid in your mouth.
All right, great. Well, I hope this episode has been helpful to our listeners at home that are going through a pregnancy or will one day. It's definitely a topic that has come up a few times, and I never knew how to answer it, if I'm being honest. But it's great. This is why we get the experts on here to answer the bloody questions, and not me. Som-Ling, thank you so much for your time. It's always lovely to have you on the show. Thanks again.
Thank you very much. Thanks for having me.
And to our guests at home, thanks for your time. Please check out the other Pearlii Podcast and download that app, the Pearlii app. Thank you.